everyone, welcome to Biophilia, your all-time study mate. Today we are going to start a new chapter about human health and disease. If you like our videos and get some help to understand these concepts, then don't forget to like, share and subscribe to our amazing channel Biophilia. So first of all, we need to understand about the chapter's introduction, that is human health. तो हेल्थ जब बात आती है देर आर मेनी अंडरस्टैंडिंग्स अबाउट हेल्थ. कोई बोलता है दैट इफ देर इज द फिजिकल कंडीशंस अ वेल बीइंग देन यू कॉल इट एट यू आर एट अ हेल्दी स्टेट. कुछ लोग बोलते हैं इफ योर माइंड इज हेल्दी यू आर हेल्दी, सो इट इज़ अ मेंटल हेल्थ. But some people say that if you are behaving well around the social people, then you are called as a well person. But actually health जो होती है वो इन सब चीज़ों को एक साथ मिला के होती है. So whenever is a person physically fit, यानी बाहर से appearance से he looks fit, if he has mental satisfaction, if he is mentally fit, if he is behaving well as socially, then you can call that the person is completely in the state of health. So health जो होता है there can be many different ways by which health can be affected. Major ones जो होते हैं these are the three, that is genetic disorders, then you can have some infections, and the lifestyle can matter the way your health is at the place. So genetic disorders जो होते हैं they are going to be because of the deficiencies which are going to affect the child when it is born. So birth के टाइम पे ही जो defects होते हैं either they are going to get inherited from the parents at the time of the birth. So genetic disorders जो होते हैं majority of them they are going to be lifetime, they are going to be with you. So these genetic disorders can be like the state wherein you don't get better, but still you can survive with these genetic disorders. But the next two, that is the infections and the lifestyle, these are at your control. Genetic disorders birth के time से होते हैं, so these are not at your wish. वो आपको मिल जाते हैं, you inherit from the parents, so you cannot change that. But you can surely prevent infections, and you can change your lifestyle so that you can be at the at most health time. So infections जो होते हैं these can be from various microbes. So ये दिखते नहीं है ऐसे microbes से हो सकता है. You can get it from some parasites, like they can be worms, they can also be infections from mosquitoes, or you can have them infected from various other things like water. They can be coming from droplet infections. बहुत सारी चीज़ों से infections हो सकते हैं. So there is you have to be very careful about your immunity as well, so that you can prevent these infections. फिर lifestyle जो होती है it depends upon how you live your life. So first of all, what you eat is going to matter for your health. What you drink, so whether you are consuming good amount of water, whether you are consuming a clean water, then and then only you can consider that you are trying to have a good lifestyle. But खाना और पानी अच्छा हो ज़रूरी नहीं है that you are having a good lifestyle. कुछ लोग होते हैं that we want to earn lot of money, we don't have time, we are busy people, they don't rest. So rest ना मिलने की वजह से once you don't get enough sleep during night or during the daytime also, you need at least 7 to 8 hours of sleep, so that you can give some rest to your body, so that it can replenish and it can repair the things जो damage हो रखे हैं. So for that you need rest, and if you don't give your body rest, then it is going to affect your health. All the time पानी खाना और रेस्ट मिल रही है, but if you don't exercise, then your body is going to get obese, and obesity is going to be one of the major reasons जिसकी वजह से बहुत सारे diseases होने के chances होते हैं. So along with your food, water, rest, exercise, that is going to give good habits and a good lifestyle that is going to keep you healthy throughout the lifetime. So जो 3 reasons देखे थे, so that was causing you the unhealthy conditions. So unhealthy conditions को avoid करने के लिए what can you do? You can prevent those by eating balanced diet. Balanced diet में you can have the correct amount of carbohydrates, proteins, then you can have vitamins, minerals and good amount of water. that is going to be a balanced diet that your body needs. Along with balanced diet, आपने खाना पानी सब अच्छे रखा है, but if you are not maintaining your personal hygiene, then it will be difficult to maintain the physical health and you won't look healthy because of your not maintaining personal hygiene. So बहुत सारे ऐसे germs होंगे, कीचड़ लगा है, मिट्टी लगा है, you don't bathe properly, you don't clean your hands properly, वही सारे germs जो होंगे, these are going to go into your body or you are going to spread those somewhere. So personal hygiene is also going to be an important point so that you remain in a good health. Even along with these, you need regular exercise, and once you have all these three maintained, you are going to maintain a very good health as per the physical health is considered. But mental health अगर आपको maintain करनी है, you need yoga so that you can have mental peace. And as the health definition states that along with your physical health, you also need to have mental and social health. So physical, mental and social health should also be considered when you are considering yourself as a healthy person. So finally, what is the need of persons to be being healthy? अगर people healthy होंगे, then and then only these are going to be very efficient at work, and when they are efficient at work, the productivity is going to increase and they will bring economic prosperity. So because of that, we say that health is going to be wealth. So health is wealth, that is very correctly said, because if the person is healthy, then and then only he is going to be capable to bring the wealth that he needs. So when the health is going to be, along with the person's life, the lifetime is going to increase, that is increase in the longevity of the people, and along with it, it will reduce the infant and the mortality. So जब भी mother healthy होगी, then and then only the child is going to be healthy, and along with it, this can reduce the genetic defects and also increase the life of the person. So that is the reason you need your health to be along with you all the time of your life. So for that reasons we have discussed कि क्या क्या चीज़ें कर सकते हो so that you can call yourself as a healthy person. So when you are not healthy, आप बोलते हो I am unhealthy, तो unhealthy यानी क्या है, you are facing some or the other disease. So disease जो होता है, that means when there is some functioning of one or more organs or systems of the body, these are going to get adversely affected. तो जो फंक्शनिंग जो नॉर्मल होना चाहिए था वो नहीं हो रहा है, तो वो जब नहीं होता है, बॉडी इज गोइंग टू शो सम साइंस एंड सिम्टम्स. सो दीज साइंस एंड सिम्टम्स शुड बी अंडरस्टूड, and then you can say that because of this altered functioning of your body, you are state as unhealthy, or you can say that you are suffering from some or the other type of disease. So normal functioning से कुछ अगर अलग हो रहा है in your body, that is showing signs and symptoms, you call it you are having a disease. So disease जो होते हैं, these can be of two types. The first one being the congenital disease. These diseases are going to occur since birth. So जो genetic disorders होते हैं, these are going to be majority of them coming from as the category congenital diseases, and these can also occur because of a metabolic disorder, and it can also be in the defect in development. So जब development of bones होना चाहिए था या development of other organs होना चाहिए था in the embryonic state, if that doesn't occur because of poor health of mother or poor health of the child, then these congenital diseases can be seen. Then acquired diseases जो होते हैं, these are going to be the diseases that come after birth. So these diseases are going to be because of the external environmental factors. So if they are going to be easily transmitted from one person to another, these are called as infectious or communicable disease. Communicable because these are going to be transmitted, they commute from one person to another. So you call it as a communicable disease. So very rapidly communicable disease previously was AIDS. So example of infectious disease is AIDS. Nowadays you can even consider about COVID-19, which is going to be a communicable infectious disease spreading from one person to another. Then what diseases that do not spread to each other, these are only because of some deficiencies. So generally जब deficiency होती है एक body में, then these diseases are going to be seen, that is non-infectious diseases, and since they do not spread from one person to other, these are called as non-communicable diseases. And major of the non-communicable disease are nothing but cancers. So cancer अगर एक को हो गया है, and you think that if you touch the person or if you go near to the cancer patient, you are also going to undergo the cancer, it is not going to happen, because and now you know that cancer is a non-communicable, non-infectious disease. So person के अंदर genetic problems होती है in the cells, and because of that the cells overgrow and form cancers. वो कैंसर को हाथ लगाया, या if you go near or if you use the same utensils or comb or anything, you are not going to catch cancer. So that was about the two types of diseases that comes. One can be from the birth, one can come after birth, or after birth maybe if it is transmitted or if it is not transmitted. So along with this, now we will also understand few different types of diseases that can be seen in this chapter. So before understanding about what type of diseases are going to be there, you need to understand कि disease exactly फैलाता कौन है. So whatever is going to cause a disease, that is disease causing organisms, are going to be called as pathogens. So these pathogens can be as bacteria, they can be funguses, they can be fungi, or they can be protozoan, helminths. Helminths generally worms होते हैं. So these can be very different types of pathogens that can cause diseases. So most of the parasites which are going to become pathogens, these are going to be causing harm to the host, because host है यानी these are parasites which are going to live into human bodies, or they will be outside. So they can be ecto or endo, but in a way these are going to harm the host, and these will enter your body by various means. जैसे ही वो एंटर करेंगे, these are going to multiply in number, and because of some entry of foreign objects, these will interfere your body vital activities, वो normal functioning को affect करेंगे. And when your normal functioning of the body is affected, there will be either morphological or functional or both damage. So उसकी वजह से you can say that has affected your normal functioning, so you are in a state of disease. So these pathogens are going to adapt to their life so that they can live inside the host. अभी आप अगर समझोगे कि कोई अगर gastric disease हुआ है, and these gastric diseases, those or pathogens are going to live in that highly acidic low pH conditions. So इतने low pH conditions जो stomach में होते हैं, how they are going to survive. So these are going to adapt, these are going to change their type so that they can survive inside those extreme conditions of the low pH, and even they can resist various enzymes so that they don't get digested. So वैसे जैसे कोई एक पैथोजन है, उसको जहाँ इन्फेक्शन करना है वहाँ की कंडीशंस को वो अडेप्ट करेगा, and then only it will be able to spread on the disease. So majority of the parasites, these are therefore going to be called as pathogens because of the three reasons. So now we will understand about the first major type of pathogen, that is going to be bacteria. So जो diseases bacteria से फैलेंगे, those will be called as bacterial diseases. So for our study today, we are going to see about these 8 bacterial diseases, that is typhoid, pneumonia, plague, cholera, diphtheria, tuberculosis, also called as TB. सो टीबी के नाम से भी अगर आपने जाना होगा इसे, then that is going to be tuberculosis, leprosy and tetanus. So let's understand about the symptoms, the causative agent, and also what kind of preventions act can you consider to avoid or to cure these bacterial diseases. So first we will start with typhoid. So typhoid हो सकता है बहुत सारे लोगों को हुआ भी होगा. You might have experienced or you might have seen some people going through this disease, that is typhoid. So typhoid is going to be caused by a gram-negative bacteria. So gram-negative, gram-positive you have already studied and understand it in class 11 as well. So these gram-negative bacteria, the shape of the bacteria also had been told to you in class 11. So अगर आपने bacteria के names shapes पढ़े हुए हैं, then you can surely understand that this particular bacteria that you can see in the photograph is going to be the causative agent, that is it is the pathogen for typhoid. So the shape along with it will be called as a bacillus bacteria. वो रॉड शेप्ड जैसा है, इसलिए यू कॉल इट एज अ बैसिलस बैक्टीरिया, एंड द नेम ऑफ दिस बैक्टीरिया इज सैल्मोनेला टाइफी. सो सैल्मोनेला टाइफी इज अ ग्राम नेगेटिव बैक्टीरिया हु इज गोइंग टू कॉज टाइफॉइड. सो वो जनरली पैथोजन स्प्रेड कैसे होगा, बिकॉज इट इज अ कम्युनिकेबल डिसीज. It is going to generally enter the small intestine. So location of infection is small intestine. और ये small intestine में कैसे पहुँचेगा? It is going to come through the contaminated food and water. So जब ये बैक्टीरिया जो है अगर वो किसी खाने में या पानी में अगर ऑलरेडी प्रेजेंट है, then it is going to be eaten by the person that infected that contaminated food or water consume करने पे it will enter into the small intestine, and from small intestine, as you know that small intestine is going to have very large amount of blood vessel. So large amount of blood vessels होने की वजह से it is very easy for the bacteria that it is going to enter to rest of the body organs through blood. So वो small intestine से blood vessels capillaries में पहुंच जाएगा, and through the circulation it will migrate to different body organs. So this is the mode of transmission. So according to the mode of transmission you can allow the prevention act. So prevention आप कैसे करोगे? Now you know the mode of transmission, यानी वो contaminated food and water से अगर पास हो रहा है, so that you should have your food and water covered, so that there is nothing falling off from any other places. You don't touch your dirty hands and eat those food. You should wash your hands. You should boil the water correctly. आपका जो ड्रेनेज लाइन है वो आपके पाइपलाइन, वाटर ड्रिंकिंग पाइपलाइन के पास में नहीं होना चाहिए. And many other things should be taken care of so that you do not consume the contaminated food and water. So now by any chance किसी कारण even after taking precautions you are undergoing this disease, that is typhoid. So आपको कैसे पता चलेगा, या how will the doctor understand that you are suffering from typhoid? So you might experience some symptoms, यानी आपकी बॉडी कोई साइंस देगी जिसकी वजह से you can understand that this particular symptoms are going to be causing because of typhoid. So first symptom is going to be sustained high fever. So high fever लगातार रहना is going to be one of the symptoms of typhoid. So ये अकेला है आपको बहुत देर तक बुखार है, it is not going to be always typhoid. There can be many other diseases wherein high fever can be sustained. So along with this type of symptom there is going to be weakness, there is going to be stomach pain, there is constipation, headache, loss of appetite, and in extreme cases, these are going to be your extreme cases. अगर infection control में नहीं आया, then in severe conditions there can be intestinal perforations, and finally because of extreme blood loss because of perforations there can be death of the patient. So ये जो symptoms है, you can very well understand why these symptoms can be seen, because whenever there is going to be any sort of infection, so generally what is the mechanism of body कि अगर कोई भी एक्सटर्नल चीज़ आपके बॉडी में आती है, देन टू फाइट अगेंस्ट इट द बॉडी इज गोइंग टू इंक्रीज इट्स टेम्परेचर. सो वेन एवर देर इज गोइंग टू बी इंक्रीज इन टेम्परेचर, वाई? बिकॉज इट इज फाइटिंग अगेंस्ट द, it can be a microbe or it can be any foreign substance. So whenever it is fighting against the foreign substance, तो वो बॉडी को ऐसे लगता है कि इट इज़ गोइंग टू बी टेम्परेचर डेफिशिएंट. सो टेम्परेचर जब बढ़ जाएगा वो मर जाएगा. सो हाई टेम्परेचर होगा सो दैट यू गेट हाई फीवर. सो जनरली बैक्टीरियाज होंगे या वायरसेस होंगे, दीज आर वेरी टेम्परेचर रेगुलेटेड ऑर्गेनिजम्स. उनको टेम्परेचर फ्लक्चुएट होने की वजह से दीज कैन नॉट फंक्शन प्रॉपरली. सो योर बॉडी इज गोइंग टू इंक्रीज द टेम्परेचर so that the fever is going to fight against the different bacteria or different viruses that can cause diseases. So first symptom तो समझ आता है why there is high fever. There is weakness because your body is fighting against something, so that there is going to be weakness. Along with it, जो टाइफॉइड का जो बैक्टीरिया है, बैक्टीरिया is going to start utilizing your nutrients because it is going to be present in the small intestine. So along with that, you will get weakness, आपको stomach pain होगा, and then you can have constipation because when the number is going to increase हो सकता है your small intestine activities are going to be affected. So constipation can occur. और ये सब जो हो रहा है, you don't feel well, your headache is going to start. और headache होने की वजह से भी you can understand कि अगर आपको सर्दी भी हुई होगी, आपका सर दर्द हो रहा है, you are not going to feel like eating anything. So that is going to be the loss of appetite. So I hope you understand the different types of relationships, that how the symptoms are going to be progressing. So तब भी अगर ये symptoms देख के you consider that you don't need to see a doctor, या severe conditions में intestinal perforations हो जाएंगे, bacterial growth बहुत ज़्यादा हो जाएगी, and there will be holes formation in the intestine, and there will be a lot of blood, internal bleeding, and death can occur because of blood loss. So finally after seeing these symptoms, हो सकता है कि डॉक्टर को और भी कोई symptoms इसमें मैच करते हुए दिखेंगे. So finally, to confirm typhoid, you can undergo a test that is called as Vidal's test. So Vidal test जब कराओगे, it will be confirmed that you are suffering from typhoid. So now we have discussed everything about typhoid, यानी वो कौन cause करता है, the pathogen, the mode of transmission. Mode of transmission से you can prevent it because you know from where does it come into your body. Then you know the symptoms if you are going to come into this pathogen's contact. And finally, to confirm, you can undergo the test that you can confirm whether you are having typhoid or not. The next disease we see is going to be pneumonia. Pneumonia एक disease है जो cause होता है because of streptococcus pneumoniae, or it can be because of Haemophilus influenza. So these two are going to be bacteria. And streptococcus pneumonia, if you remember about the shapes of bacteria that we had discussed in the biological classification chapter of class 11. So I'll try to link down the video about the shapes of bacteria, then you can check that out as well, and that would help you to understand कि कैसे bacteria जो होंगे, these are going to cause diseases, and it will try to help you to connect your class 11th with class 12. So streptococcus pneumonia is going to be a pathogen that is going to infect a healthy person by inhaling droplets or aerosols. यानी अगर कोई infected person जोर से छींकता है, या if the छींकने की वजह से, या because of used handkerchiefs, or because of coughing, all that reasons can spread these droplets, these aerosols, और ये droplets में this bacteria is going to be placed, and because of sharing of glasses or even the utensils of the infected person, the healthy person can get this type of infection. So ये जो infections होंगे, you can now understand that once this spreads because of sharing of glasses or utensils, or because of uncovered sneezing, all that can be because of the spreading of pneumonia. So आप उसको prevent कर सकते हो that you don't cause pneumonia. अगर बाय चांस किसी को निमोनिया हो जाता है, then what are the symptoms that can be seen? First of all, there is going to be infection in the lungs, because pneumonia जो होता है, it is going to affect the respiratory system. So respiratory system, even in that, the lower respiratory system is going to be affected. So infection lungs तक पहुंच जाएगा, और pneumonia is going to be very much characterized because of fluid filled lungs. So fluid filled alveoli होंगे, and once there is going to be fluid filled, so fluid fill होने की वजह से this is going to decrease the amount of air, and once the amount of air in the alveoli is going to decrease, there is going to be decrease in oxygen. So decrease in oxygen content is going to be a next symptom that is leading to difficulty in breathing. क्योंकि जब ऑक्सीजन सप्लाई नहीं होगा, देयर इज गोइंग टू बी डिफिकल्टी इन ब्रीदिंग. अगेन देयर इज सम इन्वेजन ऑफ फॉरेन सब्सटेंस, सो देयर इज गोइंग टू बी हाई फीवर, देयर इज गोइंग टू बी चिल्स बिकॉज इट इज इन्वॉल्विंग द रेस्पिरेटरी ट्रैक्ट, देयर इज गोइंग टू बी कफ, हेडेक होगा इन सब चीज़ों में. एंड इन सीवियर केसेस बिकॉज ऑफ एक्सट्रीम लो कंडीशंस ऑफ ऑक्सीजन, ऑक्सीजन जब बहुत ज़्यादा कम हो जाएगा, क्योंकि फ्लूइड जो फिल होगा इनटू द एल्वियोलाई वो ज़्यादा हो जाएगा, देन बिकॉज ऑफ दैट when the oxygen is not reaching, the surrounding tissues will undergo cyanosis. किस में जाएगा वो? साइनोसिस में जाएगा. एंड बिकॉज ऑफ साइनोसिस देयर इज गोइंग टू बी ब्लू coloration of the tissues. So the fingernails, the extremities of your body, that is your fingernails, your lips, they might turn gray or bluish in color because of less amount of oxygen reaching to those tissues. So tissues में oxygen नहीं पहुंच रहा है because there is fluid filled alveoli, and that is going to explain all the rest of the symptoms of pneumonia. So pneumonia को treat करने के लिए it is very important that the fluid inside the alveoli needs to be dried out, so that again the functionality of the lungs can be given back to the patient. So pneumonia जैसे symptoms, nowadays you have heard about a disease that is COVID-19. So COVID-19 is a type of disease, but this COVID-19 is a viral disease. It is occurring because of a virus, but उसके symptoms are also going to be very similar to pneumonia. That is, these are also going to have fluid filled lungs. But pneumonia is a bacterial disease, COVID-19 is a viral disease. So same symptoms हो सकते हैं, but the causative agent might be different. So you should also take care of it once you become a doctor, that even if the symptoms are going to be similar, you need to understand the differentiating point, that one little symptom that is going to differentiate the diseases. जैसे अगर आपने टाइफॉइड के बारे में पढ़ा था just before, तो टाइफॉइड में एक्सट्रीम कंडीशंस में क्या होगा? देयर इज गोइंग टू बी intestinal perforations. So intestinal perforations are going to be one of the particular sign or symptom, major symptom that can be helped to you to understand, to diagnose, and that can also help you to understand the disease in your exams over here. So नीट में intestinal perforations ये symptom कौन से disease का है, then you can easily understand it is for typhoid. वैसे pneumonia के बारे में अगर पूछा जाएगा, then it is going to be a fluid filled alveoli. So fluid filled alveoli is going to be the symptom of pneumonia, and even the blue coloration of fingernails and lips is also going to be an important symptom of pneumonia. So that is some important tips and points that you should remember about from the symptoms, and along with it you should also know the pathogen, वो कौन सा pathogen है जो cause करता है वो disease, and even the mode of transmission. So the third disease that we are seeing over here is bubonic plague, or it is also called as black death. Now we will understand कि उसको black death क्यों बोलते हैं, but bubonic plague or also shortened as plague as well, उसको black death बोलते हैं, and it is caused by a pathogen. Again it is a bacteria which is called as Yersinia pestis. So this disease is going to be transmitted from an infected person to a healthy person because of rodents. सो रोडेंट्स में प्राइमरीली ये डिसीज़ होता है, ये इन्फेक्ट नहीं करता है मैन को, बट मैन इज़ गोइंग टू बी एक्सीडेंटली अफेक्टेड बिकॉज ऑफ द rodents. So ये कैसे फैलेगा, that suppose for example if the person is not living in very good conditions, अगर उसके external conditions अच्छे नहीं है, वो किसी अच्छी जगह पे नहीं रहता है, there are many rats and very dirty places around, there is no hygiene maintained, तो उस कंडीशन में there is going to be a rat flea. This rat flea is going to be present onto the rat's skin, और वो जो rats होते हैं वो एक rat से दूसरे rat तक ये rat flea pass on होती है. So whenever the rat is going to die, then these fleas are going to leave the body of the rat, और उसके बीच में अगर ये flea आके ह्यूमन बॉडी पे रुक जाती है, एंड इफ इट बाइट्स द ह्यूमन बॉडी, देन द बैक्टीरिया इज गोइंग टू गो इनटू द बॉडी ऑफ द ह्यूमन. सो जनरली क्या होना चाहिए था, इट शुड हैव बीन दैट द माइस इज गोइंग टू गेट सफर्ड. सो एक माइस से दूसरे माइस तक कौन ट्रैवल करेगा, द फ्ली इज गोइंग टू ट्रैवल. ओके, फ्ली एक माइस से दूसरे माइस को इन्फेक्ट करती है. समझो अगर ये माइस में इन्फेक्ट करके ये माइस मर गया, एंड नाउ दिस फ्ली हैड टू गो टू अनदर माइस, बट अनदर माइस पे जाने के अलावा व्हाट डिड इट डू, so now he thought that instead of going to the mice, let's travel to a human. So गलती से अगर ह्यूमन को बाइट कर लिया, and then this particular mite, that is the rat flea called as Xenophila, this is going to bite the human and spread the bubonic plague. So अब ये bubonic plague अगर ऐसी conditions में किसी को हो जाता है, then the symptoms can be seen by high fever. You can also get a bubo. Bubo is going to be a lump in the region of groin or armpits. Generally this region is going to have lymph nodes. So lymph nodes जो होते हैं वहाँ पे there is going to be fighting between the pathogens and your macrophages. So lymph nodes में there is going to be swelling because of the infected region. So groin or armpits में there is going to be swelling, that is a lump or a bubo, which is going to be a characteristic symptom for bubonic plague, and it is going to also come with red patches which is going to be seen onto the skin. So जब ये bubo advance करता है या ये red patches are not getting treated, then उस conditions में these can turn black in color. This bubo, that is the lump or red patches, these will turn black in color. There will be death of the tissue. So पहले तो वो black turn होंगे, there will be death of tissue, and because of death of the tissue it is called as a black death, because body will turn black because of death of the tissues. So you can see here in the particular photograph as well कि the toes have started to turn black. Here you can see a bubo that is swelling in the armpit, and you can see the red rashes or red patches as well, which are going to be characteristic symptoms of bubonic plague caused by Yersinia pestis. So now you know कि bubonic plague को black death क्यों बोलते हैं, and along with you have also got the information about the pathogen, mode of transmission, and prevention में क्या होगा. Prevention में you can understand that rodents are going to cause this infection. So rodents नहीं होने चाहिए, उसके लिए you should maintain hygiene in your surroundings. कचरा कूड़ा नहीं होना चाहिए आसपास, so that these can be the breeding place for rodents. So rodents को दूर रखोगे, you are going to try to prevent this bubonic plague. So cholera is going to be our next disease to discuss, which is caused by Vibrio cholerae. Vibrio cholerae में Vibrio cholerae is going to be a bacteria which is a comma shaped bacteria. So shapes of the bacteria, as we had discussed, it is going to be a comma shaped bacteria, and it is going to get transmitted from a infected person to a healthy person by food and water contamination. So again, just like typhoid, इसका भी prevention होगा, that you should have clean and potable drinking water, as well as you should take or consume food which is fresh, which is cooked enough कि ये सारे जो bacteria होंगे they die and you do not have any sort of infection. So even if under these conditions you catch cholera, then the patient can start the symptoms like passing stools very frequently, और ये frequent stooling pass करने का जो consistency होगा of the stools, these stools are going to be white rice water like. So this is going to be a very important distinguishing symptom, that is white rice water type stools which is going to be passed. There is going to be repeated vomiting, and so you can understand कि there is going to be a lot of loss of water. So symptoms में जो होता है there is lot of loss of fluids. So fluids loss हो रहे हैं, पानी जा रहा है, पानी के साथ साथ there is loss of minerals, there is loss of salts. So because of that there is going to be a condition that is dehydration. So dehydration होने की वजह से what is going to happen, the person will start to feel low, उसको energy नहीं रहेगी, he won't feel like getting up, and the dehydration will cause increased thirst, पानी पीने की इच्छा बढ़ जाएगी. There is going to be dry surfaces, उसके lips फटना शुरू हो जाएगा, उसके हाथ जो होगा वो हाथों पैरों पे wrinkles आ जाएंगे, because there is going to be a lot of loss of fluids through the frequent passing of stools as well as vomiting. So vomiting से भी ऊपर से भी पानी जा रहा है, नीचे से भी पानी जा रहा है. Because of that there is very important reason that the patient should get and restore its fluid levels. So fluid levels को restore करने के लिए the person or the patient is going to be allowed to take ORS. So ORS बोला जाएगा पीने के लिए, या उसको अलग न्यूट्रिशनल ड्रिंक्स दिए जाएंगे so that the amount of fluid is going to be replenished. So lot of water should be given to the patient, and even along with it to replenish the salts and other vitamins, the ORS content should be provided to the cholera patient. So the next disease we see is diphtheria. Diphtheria जो होगा, again it is a bacterial disease. The bacteria name is going to be Corynebacteria diphtheria. The symptoms are going to include कि generally ये affect करेगा children को, that is up to 5 years of age. Generally young children में ये affect करेगा. And once this type of infection has been noticed in it, तो उसके symptoms होंगे that it will start with the sore throat. Sore throat होगा यानी गले में खिचखिच होना शुरू हो जाएगा, सर्दी लगना शुरू हो जाएगा. And since again as I told you there is infection, there is going to be high fever, and along with it till time high fever है, sore throat है, chills है, many people understand कि वो सादा कोई common cold जैसा है, it will get okay within few 2-3 days. But if you don't pay attention towards these, sometimes it may progress to have vomits, there can be headache and vomits. जब होना शुरू हो जाएगा then you will try that okay this is not normal, you should visit a doctor. डॉक्टर के पास जब आप विजिट करोगे हो सकता है तब तक जो इन्फेक्शन है वो फैल चुका होगा, and now the symptoms have been changed and they will be showing that the throat and the tonsils are going to show a grey membrane. So tonsils और throat पे grey membrane दिखेगी डॉक्टर को once it asks you to open the mouth, और mouth open करने पे you can understand how is it going to appear. So वहाँ पे throat पे tonsils पे grey membrane दिखना शुरू हो जाएगा, and that is going to be one of the important symptoms to understand about diphtheria कि tonsils और throat के ऊपर grey membrane दिखेगी. And because of this grey membrane the pathway is going to be obstructed, जिसकी वजह से hoarseness आ जाएगा, आवाज़ अच्छे से नहीं आ पाएगी. There is difference in the voice of the person. Along with it there is going to be difficulty in breathing because of narrowing of the breathing passage. So ये तो हो गए सारे symptoms that what is going to happen to the patient. Now how can you prevent this diphtheria? The prevention can be from the vaccination, यानी immunity बढ़ाई जाएगी because of vaccine, which is going to be given at the first 6 weeks of the birth, and the vaccine name is going to be the DPT vaccine. So DPT जो है, the DPT is going to be shortened for 3 diseases. The D stands for diphtheria, the P stands for pertussis, and the T stands for tetanus. So D से diphtheria, we saw that what is diphtheria in detail, हमने पढ़ लिया. Then we see about the P, which is pertussis. Again, this is going to be one of the disease that can be prevented because of the vaccination. And the T last one, that is tetanus. So tetanus का इंजेक्शन बहुत लोगों ने लगवाया होगा. Once the person gets hurt by some iron substance, iron की खिली लग गई, दरवाज़ा लग गया, most of the people go and take the tetanus का injection so that there is no disease that is going to be caused. So that is nothing but this DPT vaccine, which is going to help you to prevent the disease of diphtheria. So the next disease of bacteria, that is going to be tuberculosis, also called as TB as a shortened name, या फिर उसे कोच disease भी बोलते हैं. So if you don't find tuberculosis, if you find the name that is कोच disease, then you should not get confused कि ये कौन सा नया disease आ गया. It is nothing but speaking about tuberculosis. So the person who found out about TB was having the surname of Koch, so the disease name was kept as Koch disease. So it is going to be caused by a bacteria जिसको बोला जाता है Mycobacterium tuberculosis. So the mode of transmission of this bacteria is going to be that when this TB bacteria freely moves into the air, सो ये एयर में जब प्रेजेंट होगा और एक हेल्दी पर्सन ने उसे इनहेल कर लिया है, इट इज़ गोइंग टू गो एंड अफेक्ट द लंग्स, इट इज़ अफेक्टिंग द थ्रोट, एंड वंस द पेशेंट स्टार्ट्स कफिंग और स्पीकिंग, जो सलाइवा होगा या वो जो एयर होगी वो बाहर आएगी, एंड दिस इज गोइंग टू हैव द स्पोर्स और द बैक्टीरिया ऑफ द ट्यूबरकुलोसिस. सो जो टीबी पेशेंट्स होते हैं उनके बहुत ज़्यादा पास में नहीं जाना चाहिए, because the air nearby can be contaminated, can be infected because of these bacteria or the spores of the bacteria. So you can wear a mask, you can wear hand gloves so that your hands, your mouth or your face is not getting infected from these bacteria, and you can then go near to the patient. So पास में जाना कोई problem नहीं है, but you should take precautionary reasons. You can have a face mask, you can have face shields, you can wear gloves, and then you can go near to the patient, because patient के पास नहीं जाना बोल के कि you are going to pass on the infections, that can lead to mental disturbance कि मेरी वजह से किसी और को डिसीज हो रहा है. सो बिकॉज ऑफ दैट देयर विल बी मेंटल disintegrity, and because of that also the patient might start feeling that he doesn't want to get better. उसकी body fight करना छोड़ देगी and the condition can be worse. So you should not do anything कि जिसकी वजह से patient को mentally कोई effect हो. You can go near to the patient, you can talk to the person, उसको comfortable feel कराओ. Just take precautionary reasons so that the contaminated air should not infect to you. So that was about tuberculosis mode of transmission. अभी अगर किसी को हो गया है तो उसके symptoms कैसे होंगे? There is external invasion, there is going to be fever. Since it is going to be discussion about tuberculosis जो air से हो रहा है, so air जो होगा वो inhale हो रहा है, so we are majorly considering about the lung TB. So lung TB के बारे में जब हम बात कर रहे हैं, that is going to infect the respiratory tract. So वहाँ पे कफ होगा, there is going to be sputum which is going to contain blood, because वो बहुत ज़्यादा heavy coughing होगा, and because of heavy coughing the rest of the capillaries around that region is going to burst open और वो sputum में blood आना शुरू हो जाएगा. And because of heavy coughing as well there is going to be pain in the chest region. वो weight loss होने लगेगा because the blood is going to be flowing out, internal bleeding हो रही होगी, there is going to be blood loss, so extensive fatigue is going to be considered. लॉस ऑफ एपेटाइट बिकॉज इतने डिसीज कंडीशन में खाना खाने की इच्छा नहीं होगी. फीवर है, सो दिस फीवर इज जनरली गोइंग टू स्टार्ट टू राइज इन टेम्परेचर ड्यूरिंग द इवनिंग्स. सो इवनिंग्स में टेम्परेचर ज़्यादा होगा. रेस्पिरेटरी ट्रैक्ट इज considered in infection site, so there is going to be hoarseness of the throat, and finally there is going to be night sweating. It should be sweating, so night sweating hogi, and because of this night sweating yani evening time mein there is going to be a lot of temperature, और धीरे धीरे रात तक sweating से temperature will come down, and then there is going to be rapid pulse यानी हार्ट बीट्स बढ़ जाएंगे. एंड रीजन फॉर हार्ट बीट इंक्रीज इज व्हाट, हार्ट बीट इंक्रीज होगा सो दैट इट कैन कंपनसेट द लॉस ऑफ ब्रीदिंग. सो ब्रीदिंग कम हो रही है बिकॉज ऑफ द ऑब्स्ट्रक्शन इन द पाथवे ऑफ रेस्पिरेटरी ट्रैक्ट. सो हार्ट बीट बढ़ा के ऑक्सीजन पहुंचाने का काम कंटिन्यू करेगा. So these are going to be the symptoms that you can understand ki why these are going to be appearing in the TB patient. So lung TB के बारे में हमने बात की. The lung TB is going to be one type of tuberculosis. There can be different types of tuberculosis according to the site where they are infecting. So अगर lung involved है then these are going to be the symptoms regarding the respiratory tract. हो सकता है sometimes even your spinal cord is infected in the tuberculosis. So उस टाइम पे नर्वस टिश्यू इन्फेक्ट हो जाएगा, and then that would be considered as some other type of TB. So it depends upon what is the infection site, and this infection site will be considering different types of symptoms. So ये symptoms जो हमने देखे, these were for TB of what? TB of respiratory tract, or you can consider TB of lungs. So TB can also be prevented at some cases by the BCG vaccine. कौन सी वैक्सीन से प्रिवेंट कर सकते हो? You can take the BCG vaccine in your childhood days, or even nowadays you can also take the booster dose and all such things. So BCG का full form क्या होगा? It is going to be bacilli and calmette. So I'll write it down for you so that it will be easier for you to write it down in your notebooks as well, that what is BCG vaccine. So BCG vaccine की वजह से tuberculosis can be prevented for some time, so that immunity can be developed कि अगर second time ये same infection आपके body में आता है, that is the pathogen comes into your body, your immunity cells already recognize it, and that would give you a much more quicker effect to fight against it. So you can take vaccines for tuberculosis. You can also take vaccine for diphtheria. So दो vaccines के बारे में हमने discuss किया है till now in the bacterial diseases. Next disease is going to be about leprosy. Leprosy bacterial disease है causing by Mycobacterium leprae. So just now we had also seen about the disease tuberculosis जिसमें Mycobacterium genera was utilized. So Mycobacterium is a genera जहाँ पे tuberculosis is also going to be one of the diseases. So species change हो जाएगी bacteria की, but that is also the genera of TB. So if the question has been asked to you कि mycobacterium की वजह से कौन से दो diseases होते हैं, so mycobacterium can cause two diseases, that is TB and leprosy. So leprosy जो disease है, it is also called as Hansen's disease. जैसे TB को हम बोलते हैं Koch disease, वैसे leprosy को बोलते हैं Hansen's disease. So the other name of it also should be remembered by you, so that any one name is shown to you, you should not get confused about it. So leprosy is very famous disease with the name of Mother Teresa. So Mother Teresa had been working for this disease, that is leprosy, जो बहुत जल्दी जल्दी फैलता था between people during those times, and no one used to go near these people because they didn't look very they look different. उनके हाथ crumpled हो जाते थे, and all those symptoms we will see over here. Because of that, people used to be away from these infected persons, but these needed help to undergo this treatment of leprosy. So because of lack of awareness, so these people were separated from the rest of the healthy people. So Mother Teresa had been working for the people with leprosy, that helped them to recover mentally and fight against the disease. So mode of transmission of leprosy क्या होता है? It is going to leave the body of the infected person through nasal discharge. So जो भी nasal discharge होगा, coughing है, sneezing है, speaking है, all that can contain the leprosy bacteria, and that can come from the throat through coughing, sneezing, even speaking, as I told you, and it can go and stick to the broken skin lesions. यानी अगर किसी के कट है या कहीं पे किसी को ब्रूसेस है, उस पे अगर ये बैक्टीरिया आके बैठ जाता है या कहीं से आके चिपक जाता है, then it can easily invade into your body and that can cause leprosy. So it is very important that again you cover your mouth, you cover your eyes, you wear gloves, or you wash your hands continuously whenever you are working with any sort of patient. So the symptoms of leprosy is going to be that there is going to be appearance of light colored particles on the skin, लाइट कलर पैचेस होंगे, थिकनिंग ऑफ द नर्व्स हो जाएंगी, एंड देयर कैन बी पार्शियल और टोटल लॉस ऑफ सेंसेशन, यानी इट कैन बी अ टाइप ऑफ पैरालिसिस. So because of paralysis, these people could not walk properly, could not move their body parts properly. तो उनका यूरिनेशन, फीसेस, ऑल कुड बी वेरी डिफ़िकल्ट, एंड बिकॉज ऑफ दैट रीज़न इनकी जो कंडीशन होती थी, ये जो पेशेंट्स की कंडीशन होती थी, मेनी पीपल कुड नॉट बेयर विद दैट कंडीशन एंड दीज पीपल विद द डिजीज़ वर थ्रोन आउट ऑफ देयर हाउसेस because people were not able to handle these kind of patients. So they had high fever, they used to go from pain, there can be ulcers all over, there can be skin eruptions, and along with that, in extreme conditions, even there could be deformities in toes and fingers as well, because paralysis वगैरह हो जाता था. Slowly and steadily the sensation used to go, and many a times there could be various kinds of things जिसकी वजह से deformities हो जाती थी. So because of the deformities, they were not looking normal. So normal लोगों जैसे नहीं दिखने की वजह से people used to stay away from these leprosy people. So now you know about a very important disease that was spreaded in बहुत ज़्यादा लोगों में leprosy हो गया था during the olden days. So now you know how it is transmitted, what is the cause of it, and even the symptoms of those, and now you can relate it once you see the movies or documentaries of Mother Teresa. So उसमें आपको documentaries में आपको ये symptoms देखने को मिलेंगे that how exactly the people used to undergo the leprosy condition. The next disease we see is about tetanus. So ये last disease होगा, it is the 8th disease, that is about lockjaw. So lockjaw से क्यों बोलते हैं, we will understand it in the symptoms of it. So first of all, it is going to be caused because of a pathogen, that is again a bacteria called as Clostridium tetani. So this bacteria is going to have spores. So ये spores जो होंगे वो बहुत सारे धूल मिट्टी में या किसी एनिमल ड्रॉपिंग्स पे हो सकते हैं. सो व्हेनेवर देयर इज़ कंडीशन कि जो एनिमल ड्रॉपिंग्स है या जो गंदगी है वो आपके पानी के आसपास से जा रही है, या पीपल हैव कट्स ऑन देयर फीट्स और देयर हैंड्स एंड दे आर वर्किंग इन सॉइल, दे आर वर्किंग इन फार्म्स. सो ऐसे सारी कंडीशंस में जहाँ पे person is coming in contact with dust, dirt and animal droppings, these spores of the bacteria can easily be transmitted from the infected, and they can enter the bloodstream of the healthy person through a deep cut or wound. So अगर आपके पैरों में छाले हैं या ऐसी कंडीशन है जहाँ पे your wounds are open, and if you go and work in soil या ऐसी कोई जगह पे जहाँ पे ये spores already present है, then they can enter into your body and cause symptoms. So this bacteria is going to produce a neurotoxin. This neurotoxin is called as tetanospasmin. It is going to act at the neuromuscular junction. So neuromuscular junction यानी जो भी nerve conduction होगा to move your muscles. these are going to be affected because of this neurotoxin. जो nerve signals आगे काम करने चाहिए onto the muscles, these are going to be weakened, and because of that there is going to be irritability, there is going to be restlessness, and because of the muscles affected your neck is going to become stiff, and because of the stiff neck आपके muscles काम नहीं करेंगे of the neck region, there is going to be difficulty in chewing, in swallowing, खाने में चबाने में परेशानी है, उसको निगलने में परेशानी है, and along with the neck muscles, your muscles of the jaw, you cannot smile, you cannot move your jaw, the face muscles are locked, and that reason is why it is called as a lock jaw. कि जो भी muscles होंगे, these muscles are going to get stiff, and this muscles stiff क्यों हो जाते हैं? Because of the neurotoxin produced, and which works at the neuromuscular junction. So brain से functions आएंगे, signals आएंगे, but your muscles will not be able to respond to those signals. And finally, this toxin is also going to affect the voluntary muscles. So voluntary muscles में your breathing muscles are also going to be affected, your diaphragm movement is affected, and all that things will cause the breathing problems as well. So tetanus जो है, it can be actually prevented, and these tetanus organisms are going to live in the intestines of horses. So intestine of horses में these are going to be naturally be present, और ये आपको अगर it might be fascinating to you that you might think कि tetanus का जो बैक्टीरिया है वो अगर intestine of horses में रहता है या other animals में रहता है तो क्या उससे टेटानस होता है? Then you are thinking about it. The answer is going to be it does not affect the horses. So वो horses या किसी और animal को affect नहीं करेगा. And why it will not affect? Because the horses have inbuilt immunity against these bacteria, and because of that immunity we are going to use it for our treatment. So when the person is having tetanus, the human is suffering from tetanus, he will be given anti-tetanus serum. So anti-tetanus serum injection जो होगा उसको horses से या किसी और animal में जिसके पास immunity है against tetanus उससे collect किया जाएगा, and then it will be administered during the case of injury. So injury के time पर जब आपको खीले लग गए या कोई रस्टेड खीला लग गया, या if you have cuts and bruises and you are working in soil conditions or any such conditions जहाँ पे आपको डाउट है कि टिटेनस हो सकता है, you go and take a injection. That is nothing but can be one, that is a vaccine that you can take, that is diphtheria, pertussis and tetanus vaccine together, or you can also take the anti-tetanus serum injection. So अभी एक important चीज़ हमें डिस्कस करनी है, that is the bacteria which is having the spores. So bacteria के पास जो spores होते हैं, these spores are going to spread into the central nervous system. तो blood stream से वो कहाँ जाएंगे? They will go into your central nervous system, और वहाँ पे ये toxin produce करेगा, that is the toxin that we studied, the tetanospasmin. And now this toxin is going to be spreaded in all over the body, and it is going to block the nerve signals. So nerve signals जब block हो जाएंगे, that is going to cause the symptoms that we discussed. And nerve signals block कहाँ पे होंगे? Of the spinal cord. So spinal cord से majority of your signals are going to go to your muscles, the voluntary muscles, जिसकी वजह से the symptoms can be very much understood. So that was about our last disease of bacteria, that was tetanus or the lockjaw. So after understanding the entire theory of bacterial diseases, now it's time that you check your understanding. So वीडियो पूरा देख लिया है, आपको अच्छे से चीज़ें समझ आ गई है. Now you have to solve these questions. I know these are not sufficient for your examination, but it will give you an idea about how you should understand these particular topic. So now you can solve this. आपको आंसर जो होंगे आप शेयर कर सकते हो in the comment section down below. and you can have a healthy discussion about these topics. You can also post some of the good questions that you come across during your practice so that other people who watch our videos get benefit out of it. And with this we see the MCQ part as well as the theory part that you should understand about the topic. So that was all about for this video. The part 1, that was bacterial diseases, complete ho chuka hai. We will come back soon with the second part of diseases that will be about viral diseases. Till the time we come back soon, if you liked this video, then do communicate to us by like, share and subscribe to our amazing channel. Till the time we come back and meet you soon. Take care everyone. Bye bye. Keep studying, keep smiling. Thank you.